George Kilpatrick Inspiration for the Nation, celebrating people that we feel good about. Dr. Ofrona Reid is the Chief Medical Officer for the Syracuse Community Health, and he's also here to talk about men's health. June is Men's Health Month, and so he's here to help us, brothers, men, do what we have to do to take care of ourselves during Men's Health. Let me start with maybe some myths that men don't want to take their health seriously, or that they're reluctant to go to the doctor and get the support that they need. Is that a myth or reality?
That's a reality, actually. I think the usually when it comes to a colonoscopy, that's when I see a lot of patients, men, resistant because of the whole myth of they don't want anything going in that side.
Mm-hmm.
And so it takes a lot of education to, inform them of the risk of developing colon cancer, or even finding a polyp that's actually benign, but that polyp can, become cancer 10 to 20 years down the line.
Well, I'll say, as someone who's had a colonoscopy, you don't, whatever your concern is, you don't feel nothing because you're under anesthesia, and whatever they find, they fix, and you're done. So I often, people will say the worst part is the preparation the night before, and they're absolutely right. So we wanted to get the top 5 concerns for men's health. And so, Dr. Reid, I know you have some things you want us to know about.
Yeah. The top 5 concerns of men's health, number 1 would be heart disease. And 1 out of 4 men have heart disease, which is hypertension, diabetes, or cardiovascular disease. Number 2 is actually stroke, which is concerning. Number 3, which is the most surprising to me, is depression and suicide. Number 4 is lung cancer, and number 5 is actually prostate cancer.
Really?
But what's shocking the most to me is that the fact that depression and suicide is number 3, which oversurpassed lung cancer and prostate cancer.
And so I know mental health certainly is a concern that has been addressed a lot lately. Depression and suicide, and I don't know if you have that broken down racially, but this is a concern that we've been hearing a lot more of in recent weeks, or maybe in recent years. Maybe it's because there have been certain celebrities like Charlemagne, for example, who've been bringing attention to it. Although I'll go back to my good friend Terry Williams, who wrote a book, Black Pain That Only Looks Like We're Not Hurting, where she talked about that piece. She talked about this years ago. And so it seems like we're now having an increased awareness, but that surprising numbers, you said depression and suicide, number 3 regarding men's health in particular, that's surprising and alarming to me as well.
Yeah, I think a lot had to do with, one, we men in the 40s and 50s, our testosterone level, decreases, it declines, mainly at the age of 50. And that leads to a lot of mood swings and issues with sleep, depression, increase in, body weight, decrease in muscle tone. And then men begin to worry about, career woes, relationship fears, and, status, which brings stress as well. So I think all these play a role, along with just the regular things we go through as men in life, Black men in life,
Mm-hmm. When you talked about decrease in testosterone and the corresponding decrease in estrogen in women is menopause, if you will. I don't know if that's exactly that right, but I'm making that leap an assumption. But we don't talk about whether there's such a thing as male menopause.
And you're 100% correct. See, we hear a lot about women in menopause, but men go through some issues when our testosterone was low as well. We do get depressed. We do have problems with sleeping. We do have mood disorder. So those are all associated with decrease in testosterone levels. We have a lower sex drive, erectile dysfunction. All those, that plays a role in testosterone level, which is equivalent to a woman who actually goes through menopause.
And so when you look at those health concerns, heart disease, you mentioned heart disease, you also mentioned stroke, suicide, depression, prostate health. And what was number 4?
Number 4 is lung cancer.
Lung cancer, right?
And 5 is prostate.
So let's talk about prevention. And I guess the first thing you would say is regular checkups with your physician or primary care physician. Now, in the Black community, I mean, obviously we have the community health center for various populations or for all populations, quite frankly. But this idea of regular health checkups is, I'm sure, one of the first things we could do around prevention.
Yes, I totally agree with you. I think prevention is, keeping up with your medical appointments, exercise, nutrition, definitely. Studies show spirituality as well as proper thinking. Those are
Mm-hmm.
all preventative measures. As far as trying to avoid heart disease and and things of depression. Another thing I tell you, for lung cancer, if you smoke, then you want to be screened for a CT, a low dose CT scan, based on the criteria of your prostate. You want to do your prostate test at the age of 50, and check a PSA level. If your PSA level is actually a blood test, you check for prostate cancer. If you have family history of prostate cancer, then you want to check your prostate even earlier than that. Most men think that they got to have a rectal exam for a prostate test, but we no longer really depend on a prostate exam because now we can order through the blood, to help screen for prostate cancer.
And so you mean I don't have to get the rectal exam if I don't need? Is that something I don't need anymore? Or because I thought that was also one way to. So the PSA will tell if there's an enlarged prostate as well as whether there's some problems with the prostate, and you don't have to rely on the rectal exam anymore.
Not solely by itself. So
Okay.
it's controversial. There's some urologists who will say that you do a rectal exam and then you do a PSA level the same day. Is the rectal exam affecting the PSA level?
Right.
And
Okay.
so it's very controversial, to be honest with you. But I do know that following the prostate specific antigen, originally it was originated for someone who had prostate cancer, and you want to follow the level. But that sense has changed. Now you can do a prostate level, and the range is 0 to 4. And if it's above 4, there's some concerns. If there's prostate cancer or enlarged prostate or inflammation of the prostate. However, say it's within the normal range. Say you got a 1 and the next year it goes to a 3. That's a big jump. That's a big concern. Although it falls within the range, that jump is a big concern. And if you have a high family history of prostate cancer or you're African American male, you might want to get evaluated by a urologist.
Sure. And again, as part of a routine screening, and I think when I think about some of the things we're doing, for example, we're doing the Jazz in the City series, July 13th, coming up which is the next one. Actually, that's not the next one. That's the one after the next one. But you'll have health screeners there. And I always say, when you go to those fairs, it doesn't hurt to get that blood pressure checked or whatever the tests are that they're offering to just see where you are. And I've said this before, all of the things that I have been screened for has resulted in me having a follow-up with my physician. And we've dealt with some health things that have come up, screening at community events, just like the one we're having at as part of the Jazz in the City on July 13th at the new Community Health Center, which will be opening a little later on officially in the summer, but we'll have sort of a preview, if you will, on the site on July 13th as part of the Jazz in the City series. But to your point, you said, I want to go back to what you said about your thinking, which you said a positive mindset, your faith. Those are things that can help when you think about some of these conditions, but you also have to take preventive measures. So, for example, with stroke, we've got to watch our salt intake, if you will, or not our salt intake. Tell me how we prevent stroke.
Yeah. So a lot of times, you got to think about cardiovascular disease and stroke. You're thinking about clogged arteries, or what's causing plaque to build up. So that's going to be low cholesterol diet, as well as low salt, because you want to control your blood pressure. You're correct.
Right.
Because high blood pressure can lead to a stroke. Just like high fat diet can lead to a stroke. So to your point, you do want to have a low sodium diet because you want optimal blood pressure control to prevent a stroke.
And so lung cancer, obviously, decrease smoking. Now, I want to get to this issue of cannabis, right? Because with cannabis being legalized and people have been smoking anyway, are you concerned about that because people smoking, I don't know which is worse, smoking or cannabis, smoking weed, if you will, the increase in number of us meaning community wide, who are turning to weed as an option. Do you have any particular concerns about that? And I say turning to, not me particularly. I'm just saying generally speaking. Do you have concerns about that at all, and whether that could be potentially um, another risk factor for lung cancer?
See, cannabis has been around for decades, years, as we know, and there's no studies that show a relationship between cannabis and lung cancer. I mean, it's been around,
Right.
so it's not nothing new. I think the issue now with cannabis is that I saw a study recently that showed an increase in peripheral vascular disease, which is also like clogged arteries. Again, there's only one study. The study has to be peer reviewed, so I don't want to jump to conclusions. But the study did show significant increase in peripheral vascular disease in patients who actually smoke cannabis.
And so my assumption, because I'm thinking, okay, tobacco, cannabis, what's the difference? But you're saying from the studies, there is a difference.
There's a difference because when you look at cannabis and you look at nicotine, they've both been studied widely in as far as lung disease. And tobacco is clearly associated with lung cancer. Tobacco has 100 cancer-causing agents in it, which we know. Cannabis, it has not been proven to show any signs of cancer-causing agents in it. And there's not been any connection between cannabis and lung cancer that I'm aware of. The only thing I've seen with cannabis thus far, most recently, was the increase in peripheral vascular disease. And again, that's only one study.
And what is that called again?
It's called peripheral vascular disease.
Peripheral vascular disease. Okay, I wanted to hear it. Okay, yeah, and then of course I think you said the last one was prostate health. We talked about that, making sure you get your PSA levels checked, urology checked, and things. Going to a urologist or even your primary care physician. You are remind us of your area of specialty again.
My area of specialty is internal medicine.
Okay, internal medicine. Yeah, all right. Just so you're treating adults like me, right? So,
yes.
Overall, with men's health, these are the 5 concerns. Once again, you talked about heart disease, you talked about stroke, lung cancer. I always forget the next one.
No, the third one is the depression, suicide.
Depression, suicide. That's the one I'm missing.
Lung cancer and then prostate cancer.
What can we do as men to decrease our increasing levels of depression and suicide?
I think we have to be transparent with how we really feel. I mean, men, we got the stigma of this masculinity of being macho, that we can't be depressed. But a lot of us are depressed, and I think with depression we don't seek help, and it gets to a point where it builds up where you can't take it anymore. And the best thing, not the best thing, but the best option they think they have is to commit suicide. But I think talking more openly about how we feel as men being depressed, each and everyone being transparent with one another, is going to make a big difference.
Yeah, no, I think that's right, and I guess we have to get comfortable talking to one another about how we really feel, because we've become so comfortable in wearing a mask. Hey, I'm all right, you know what I mean?
Right.
And then, but the other thing is, when you do open up, a lot of times, I would say, I'm just thinking about conversations I've had. Sometimes brothers don't know how to respond to when you put it out there like that. They don't know, because they're not used to that kind of, quote unquote, vulnerability, if you will. So we also have to get used to hearing when people say, this is how I really feel, and being able to respond. Any suggestions about that?
No, I think, sometimes, men get together and, and be, I think we'd be more intentional about, having a gathering, and the focus is on depression. So we got to be more intentional about talking about these things.
All right.
Such as
yeah. Anything else we need to know about men's health as we talk about men's health and how we can heal and be better?
No, I just think that, the 4 pillars we got to focus on is going to be exercise, nutrition, proper thinking, and spirituality.
Exercise, nutrition, proper thinking, and spirituality. And, nutrition, once again, leafy greens, low fat, the usual, right? Lots of green leafy fruits, things that avoid. right? Beans, decreasing your amount of sugar. What's that? Refined sugar. Yes, that's the word I'm looking
Yeah.
for. Refined sugar.
And
My
speak about sugar, just so let's go. So when you say sugar, understand. So you have simple sugar, which is like table sugar, and you have complex sugar. Complex sugar is like in rice, it's carbohydrates.
right.
Carbohydrates are complex sugar. It's very hard to break down, and that turns into actually fat. So avoiding too much carbohydrates. You want carbohydrates, but you want to balance the carbohydrates, proteins, fruit, vegetables.
Yeah, and that'll be very helpful. The usual, right? Whatever works is what we should probably be trying to focus on. All right, Dr. Ofrona Reid is the Chief Medical Officer at Syracuse Community Health, and they're located at 819 South Salina Street, but not for long. But not for long. If you and of course you can call them, and they're also a partner with Inspiration for the Nation, so we thank them for that as well. All right, Doc. Unless you got anything else, we appreciate you joining us on the program to help us talk about men's health. What he said the keys were: exercise, nutrition, proper thinking, and faith. And proper thinking meaning mental health, positive thinking. I guess is probably more along those lines. But we got to get it right so that we can be the best that we can be for ourselves and for our family.
Yes, thank you for having me too.
Inspiration for the Nation.